All right, let's jump right into this. You know, we all just want that peace of mind when it comes to our health, right? But let's be real. When weird, unexplained symptoms pop up, or maybe you're just trying to get a handle on your family's medical history, staring down the sheer number of diagnostic options out there, it is completely overwhelming. So, in today's Explainer, we're diving straight into the world of targeted, premium medical checkups in Germany. Specifically, we're going to break down the framework built by Euromedical Expertise, which is coordinated by Dr. Hind Hlali. We'll look at the source material to figure out which exams you actually need and see exactly how a truly tailored approach leaves those standard, off-the-shelf health screenings in the dust. So here's our quick roadmap for the Explainer today. First up, why personalize your checkup? Second, inside a tailored checkup. Third, the physician-led advantage. And finally, your seamless medical journey. Okay, section 1, why personalize your checkup? The myth of the full-body scan. When we get anxious about our health, our gut instinct is usually just to test absolutely everything, right? Just put me in the machine. But the source material poses a really crucial question. Is a full-body checkup always necessary? And the documentation actually suggests the answer is no. Look, there's this massive, booming industry of standard medical packages promising to scan you from head to toe. But clinically speaking, running the exact same battery of tests on a completely healthy 30-year-old as you would on, say, a 60-year-old with a history of smoking, it's just not the best practice. It often leads to completely unnecessary investigations, false positives, and, honestly, a whole lot of unneeded anxiety. The documentation points out this really stark contrast between a generic package and a personalized checkup. A generic approach, which is what you usually get from standard booking agencies, is basically a one-size-fits-all model. It's kind of like throwing darts blindfolded and hoping you hit the bullseye. But a personalized approach, that is tailored specifically to you, your age, your symptoms, your family history, and your specific individual risk factors, like hypertension, obesity, or diabetes. I mean, think about it. A patient with cardiovascular risk factors absolutely needs a completely different diagnostic path than someone who's going in for a metabolic evaluation. Personalization isn't just a nice to have, it's the absolute core of effective preventative health. Moving on to section 2, inside a tailored checkup. Let's look at this precision diagnostic toolkit. So, what actually happens when you strip away all those unnecessary tests and focus strictly on what your unique body needs? Well, it starts with the core diagnostics. This is all about establishing a really vital, incredibly detailed baseline. We're talking a thorough internal medicine consultation combined with targeted blood and urine lab testing, plus precise checks on your blood pressure, glucose, and cholesterol. This is the foundational detective work that helps catch potential health mysteries way before they ever become emergencies. Now, building on that baseline, the next layer up is the cardiovascular assessment. Rather than just throwing everyone on the exact same treadmill, specialists evaluate your heart health using targeted tools like an ECG or echocardiography, but only when your specific risk factors actually call for it. These aren't just your standard routine boxes to check off. They literally give doctors a highly personalized window into your future heart health. It lets them spot trends and step in years before a serious cardiac event might ever happen. And beyond the heart, this toolkit expands out to advanced imaging, like ultrasound and radiology, along with specific cancer screenings. But here is the absolute critical takeaway from the source material. These powerful tools are deployed selectively. They are dialed in precisely to your age, your sex, your family history, and your individual risk profile. It's a highly focused defense against the specific conditions you are statistically most vulnerable to, rather than just blindly scanning everything and hoping for the best. All right, section 3. The physician-led advantage, going beyond simple booking agencies. So we've covered the clinical diagnostics, but now we've got to ask the big question. Who is actually coordinating all of this care? There's a quote straight from the source material that highlights a huge distinction. It says, unlike simple booking agencies, Euromedical Expertise provides physician-led medical coordination for international patients. So why does that actually matter? Well, with a standard sales agency, you're usually just dealing with administrators who are trying to sell you a fixed menu of services. But when your journey is coordinated by a medically trained specialist, every single step is being audited by a clinical pro, someone who actually understands the hard science behind the test they're recommending. And for Euromedical Expertise, that service is coordinated by Dr. Hind Hlali. The documentation highlights her elite background. She's a German board-certified specialist physician with direct clinical training inside highly research-driven German university hospitals. She has academic residency mastery, which basically means she knows the complex subspecialized protocols of the German medical hierarchy inside and out. Plus, she's multilingual. She speaks English, Arabic, German, and French. This means she can communicate directly and seamlessly with international patients, especially folks traveling from the USA and GCC countries. She's not just a coordinator, she is your clinical advocate. Okay, Section 4, your seamless medical journey, from your home to Germany and back again. So how does this physician-led concierge service actually play out in the real world? The source material maps it out perfectly, step by step. It kicks off with Step 1, the initial medical review, which is actually done completely remotely before you even book a flight. Step 2 is checkup planning, where they design that custom diagnostic pathway we've been talking about. Step 3 is specialist coordination, matching you up with the absolute best providers in Germany or Switzerland. Step 4 covers the estimates and booking the appointments. And because everything is customized, your estimates are based on your exact medical needs, not some inflated flat rate. Step 5, they provide travel and accommodation support. And finally, Step 6 is the medical follow-up, ensuring you have total continuity of care even after you've flown back home. Now, to make that initial remote medical review as accurate as possible, patients just need to gather a few things from a preparation checklist. It's pretty straightforward, but totally vital. You need your medical history, your current medications, any previous lab results or imaging you have, a detailed family history, and a clear list of your specific health concerns or unexplained symptoms. Look, getting all this together upfront is what allows your medical coordination to be absolutely precise right out of the gate. So what does this all mean for you? We've unpacked why one-size-fits-all packages fall short, and we've walked through the framework of a truly tailored, physician-led diagnostic journey in Germany. Which leaves us with one final thought for today's explainer. In an era where those generic, off-the-shelf health packages are absolutely everywhere, isn't it time we demanded that our medical diagnostics be exactly as unique as our own biology? Are you ready to stop guessing and start your personalized medical review with a true specialist?